This presentation has been prepared to provide local governments with information regarding how local government reporting to the Department of Health will be changing as part of the next stage of implementation of the Public Health Act 2016, Stage 3. In this presentation, we will discuss a number of items relating to Stage 3 and local government reporting. This will include a brief overview of Stage 3, details of the current local government reporting requirements under the Health Act 1911 and the new reporting requirements under the Public Health Act 2016. Outlining local government functions under the Public Health Act and what that means for reporting. Explaining the reporting provisions in the Act, including what reporting will be required at Stage 3, what the expected timeframes of collection of information will be, how reports will be collected, and what the data may be used for. Finally, this presentation will discuss details on how reporting will be changing over the staged implementation of the Public Health Act 2016 and where to go for further information. At Stage 3, various provisions within Parts 1, 2, 17, 18, 19 and 20 of the Act will come into operation. The specific details about which divisions and subdivisions will be enacted are shown on this slide. More specific details relating to these parts and what they mean for local government is provided in the presentation entitled Staged Implementation of the Public Health Act. The enactment of Part 2, Division 3 means that local government reporting under the Public Health Act will come into effect at Stage 3. Local governments have been reporting to the Department of Health under the Health Act 1911 as required by Section 38 shown on the slide. At Stage 3, the Health Act 1911 will be renamed to the Health Miscellaneous Provisions Act 1911. Section 38 of the Health Miscellaneous Provisions Act will be repealed at Stage 5 of implementation of the Public Health Act. At Stage 3, Section 22 of the Public Health Act 2016, reports by and about enforcement agencies will be enacted. This section applies to all public health enforcement agencies, of which local government are the main enforcement agency. As can be seen on this slide, Section 22 is split into three parts. Firstly, Subsection 1 requires local governments to report to the Chief Health Officer on their performance of functions under the Act by local government and by persons employed or engaged by local government. This reporting will be required annually based on the functions performed during the previous financial year. Subsection 2 requires a local government who has commenced or finalised proceedings under the Public Health Act to notify the Department of Health within a month of these occurrences. Whilst the requirement for reporting on proceedings will be enacted at Stage 3, the sections of the Public Health Act 2016 that allow local governments to commence proceedings are not enacted at this stage. Subsection 3 requires the Department of Health to include a report on the performance of enforcement agencies of functions under the Act in its annual financial report. In addition, the knowledge gained from this reporting is to be used to inform the State Public Health Plan. Due to the staged implementation of the Public Health Act, Section 22 will be enacted at Stage 3, but a number of the local government functions will not have been enacted at this stage. This means that full reporting requirements of all a local government's functions under the Public Health Act will not be required for a number of years. The reporting requirements will be rolled out in line with the staged implementation of the Public Health Act 2016. And local governments will be informed on how the reporting requirements will change as and when it becomes relevant. As discussed in the previous slide, Section 22, Part 1 states that enforcement agencies need to report on the performance of functions under the Act by that agency. For local governments, their functions under the Act are outlined in Section 16 of the Public Health Act 2016. The functions include public health planning, public health policies and programs, administration and enforcement of the Public Health Act, and additional functions as specified by the Act and its associated regulations. The staged implementation of the Public Health Act means that local governments will not be required to perform all functions under the Act straight away. Reporting at Stage 3 will therefore be limited mainly to the administration and enforcement of the Public Health Act 2016. Matters that continue to be regulated under the Health Miscellaneous Provisions Act 1911 will no longer need to be reported on under Section 38 of that Act, as the annual report form, local authorities' regulations will be repealed at Stage 3. Therefore, once Stage 3 of the Public Health Act is implemented, local governments should focus on reporting under the Public Health Act only. At Stage 3, local governments will have two options for undertaking their Public Health Act reporting. Online survey, similar to SurveyMonkey, or by filling in a Department of Health generated form, similar to how the Food Act 2008 reporting is currently done. The Department of Health will make the survey link and reporting forms available to local governments both online and directly if requested. It is expected that these reporting options will be made available in July 2017. Local governments will then have a number of options to submit the form, including email, fax, or post. For the next Public Health Act implementation stages, the Department is looking into other reporting options to try and make the reporting process more automated and online. Whilst the Public Health Act 2016 is at Stage 3 of implementation, local governments will only have to report on the provisions of the Public Health Act that have come into effect. Matters which may be required to be reported on include: what is the number of full-time equivalent Public Health Act 2016 authorised officers working in your local government? What is the number of full-time equivalent persons that assist authorised officers with their duties under the Public Health Act 2016 in your local government? Has your local government experienced difficulties recruiting staff to undertake the Public Health Act 2016 related work during the reporting period? Has your local government had any designated authorised officers cease to be an authorised officer during the reporting period? If yes, how many? How many proceedings were commenced during this reporting period? How many proceedings were completed during this reporting period? The requirement to reporting on offence proceedings will be enacted at Stage 3. It is unlikely that there will be any proceedings to report on during Stage 3, as the various sections and regulations under the Public Health Act that local governments will be able to use to commence proceedings will be enacted in Stages 4 and 5. The first reporting period under the Public Health Act will commence the date that Stage 3 comes into effect. In accordance with Section 22, Part 1, the Chief Health Officer will require reporting to be provided on an annual basis to coincide with financial year reporting. As such, it is expected that the first local government reporting period will be from January 2017 to July 2017, with the first report due by October 2017. The Public Health Act 2016 provides a risk-based approach to managing public health risks in Western Australia compared to the Health Act 1911's prescriptive approach. Data is a key component in being able to understand the public health risks across WA. It is hoped that the reporting by local governments under Section 22 will help gain an understanding of how the Public Health Act is working and how effective the management and enforcement of the public health risks are. Once full reporting requirements are implemented, the Department plans to use the data collected to ensure that aspects of the Act are working as they should. Assist with the review of the Public Health Act, which is required every 5 years by Section 306. Assist to gain an overarching picture of public health risks across the state of Western Australia and help to get a better understanding of these risks. Gain an understanding of how public health risks are being managed. Create a data source to inform public health planning and evidence-based policies at state and local level. Provide evidence for preventing and responding to high-risk and emergent activities. In addition, as dictated by Section 22, Part 3 of the Public Health Act, the Department of Health must include in their annual report a report on the performance by enforcement agencies of functions under this Act, where the data collected as part of Section 22, Part 1 from local governments will form the basis of this section. The annual report will be made available online from the Department of Health's website. The Department is currently assessing options on how the data will be stored, used, and made available for research, analysis, and planning, and will update local governments as and when an option and policy position is agreed upon. Details relating to information sharing will be further discussed at the time of Stage 4 implementation. Reporting requirements will change when Stage 4 is implemented, with additional reporting requirements communicated with local governments prior to the implementation of Stage 4. For further information regarding local government reporting under the Public Health Act 2016, visit www.health.wa.gov.au or email publichealthact@health.wa.gov.au with specific questions.